Good morning, everybody. I'm Dr. John Willardsen here with my compadre Memo Gea, and we've got a great live stream today for you guys. Thank you to all of our viewers who are watching this morning. And we're going to go through a lot of, well, first of all, I'd like to start off with kind of a case of the week, a start. So this is a patient who started treatment. I don't have any after photos because I literally just did his surgery maybe 3 days ago. But I'd like to kind of start off with showing the what this is when we look at how the jaws align, and we call that the occlusion. And so if you've got somebody who has their lower front teeth in front of their upper front teeth like this, and there are certain individuals that have this situation. We call this a class 3. So a class 3 is where the lower teeth are in front of the upper teeth. A class 2 is where the upper teeth are way in front of the lower teeth. And then a class 1, which is ideal, which is what we build our cases into, is where the top and bottom teeth articulate. They're very intimately tied together. We have what's called 1 millimeter of overlap, 1 millimeter of overjet, and the teeth are in a class 1 position. So this is a class 3 where the patient's lower front teeth, when he bites down, are behind his, the upper front teeth are behind his lower front teeth. So when I get the final photos on this case, I'll show it to you because we've got him in provisionals right now, and it's turned out to be, it's going to be an amazing transformation for him. So I'm excited for him to do that. Next one I'd like to show, and I've shown this case before, but this was a patient who came to my office, and she actually has on her upper jaw, I believe it's 11 implants, and then on the lower 6 or 8. I don't recall. I have to look at the x-ray. But when she presented to me, she had all of these implants in place, and she had this upper denture, which was screwed down. And I've shown this case before, but I want to kind of, because I have a case that I just completed to kind of look at the two different distinctions. But so this denture was screwed down on top of her implants. And if you can imagine, even just one day, so she can't remove this. It's screwed down. She can't take it out. And all of this plastic here on her palate or on the roof of her mouth is covering. So it's a denture that's screwed down on top of the implant, supported by 3 implants. She has 11. By the way, these implants were, at this time when I did her case, were placed 11 years prior. So just to give a little bit of a background and a history. So, and this is again kind of why I say the system is broken. So here's a patient. She went, and in fact, let me just show her CAT scan because then we can see kind of what I'm talking about. So all of these implants were placed 11 years prior to me meeting her. And when she came to me, she had this denture thing that was screwed down on top of the implants, and here's her before photo. And so we've got and you can see it's fractured in the middle. So now you've got this broken denture that's screwed down. Imagine trying to clean this. Even just one day of, one meal, for example, and the food that gets impacted, that gets lodged in underneath this denture, and the fact that she can't take it out and clean it, just one day it would be the bacteria buildup would be extreme. 2 days, even more. This thing had been in for like 8 months. So when I took it out, it was just awful. And so, not to mention the trauma, the damage that it does to the tissues, to the implants. It's just a whole host of really a lot of things going on here. So anyway, she comes to me. Implants had been in place for 11 years, had tried every way to get this case restored, was not having luck, obviously, ended up in many different offices, and ultimately ended up in my office, and we were able to, just getting the parts for these implants, because they were old. You can see it's an external hex, so these were, I believe they were 3i implants, and so the connection, talking dental stuff here, the connection, the way that the parts and pieces fit together. This is like from the early 2000s, probably maybe late 90s. But all of these implants had been in place for that long and unrestored. And you can see how the tissue is very kind of red, inflamed. It's there's a lot of what we call granulation tissues, so the tissue is kind of growing outward. And that's because this denture sat on here for so long, and it caused the tissues to inflame and become red. Fortunately, she's a very clean lady, but there was just no way for her to clean underneath the denture that's screwed into place and had been in there for months and months on end. So she did as good a job as she possibly could. This is just the restoration process. You can see how many implants she has here. So there's a lot of implants. And when I say the system's broken is because this case was done, implants were placed, but there was no plan in the restoration process. So when the doctor placed them, like, who's going to restore this case? It was an oral surgeon that placed them. But then after the oral surgeon was done with his part of the job, he was kind of like peace out, so to speak, and she was left kind of high and dry for 11 years. So
that's what I was going to ask, doctor. So in it seems like I haven't seen this case before. But
you haven't? Oh.
No.
Yeah.
It's interesting. This is new to me, but just seeing that, if you were to just show me all those images, I would think that
everything was normal, right?
Well, after seeing the 11 implants, then also the prosthesis on denture, just 3.
On 3, yeah.
In Spanish, when someone does a job like that, we call it a Mickey Mouse. And
yeah.
It's because it's just
Mickey Mouse. Oh,
just put it.
I mean, Mickey Mouse is an understatement.
Yeah.
When I saw it at first, I was like, oh my gosh. I cannot believe that the one that, and I kind of feel bad for the restorative doctor because he was in way over his head. He had no idea what he was doing or what to do or how to manage it. He was just trying to help this lady and not making progress at all. But this was a specialist who was restoring the case or attempting to restore the case. So, but yeah, it definitely, and to have, and I only show this case, not to like degrade on the doctors at all, but for the patient to have gone 11 years with all those implants in place and then really be left with no way to restore it and be stuck with this denture that's causing so much damage and trauma to the tissues, to the bone, to the implants. The money that she spent was well over $280,000 to get this case finally finished. So, and ultimately we were able to finish the case. Turned out beautiful. She was very happy. And fortunately, I'm glad that she found us because it was within about 2 months and she was done. So we took that problem that she struggled with for 11 years and being stuck in between a surgeon who placed the implants and a restorative doctor trying to restore the case. Ultimately, she found us and we were able to get it done for her real quick. So now, a patient that we start from scratch, very different scenario. I mean, all cases have their own nuances and all cases have their, we have to treat each patient individually. And so she had been seen and had been diagnosed for all on 4, upper and lower. And when I found her, when she came in, I just like grabbed on. I'm like, no all on 4, no all on 4 for you. And so, here's a kind of a before photo, and I'll show her before X-ray. Let's see, it's right here. So this is pre-op X-ray. So, the plan would be take out all these teeth, do 4 implants upper, 4 implants lower. I mean, complete travesty. That would be an absolute mistake. But what does the patient know? They don't know any different. Like they go in, okay, all right, that's what you suggest. I'm hearing all these ads about all on 4. Okay, let's go. Let's take out all my teeth. But thank goodness we found her or grabbed her before she ended up making that mistake. And then we went ahead, did proper implant surgery, proper positioning, proper grafting in the sinus. We're not avoiding the sinus like they talk about in a lot of these TikTok and YouTube and social media videos. They don't want to, what do they call it? Intrude the sinus. They want to intrude the sinus. The sinus is okay to intrude because you're going to put an implant in the right position. And so we'll just kind of take a look at her after photos here. Oh, one thing I wanted to show is a cross-sectional view. So on that original case that I showed, on this one with that denture that was locked in there, again, it was 11 years ago, but it kind of goes into the skill set of a surgeon placing implants and how delicate this procedure is. It's not, even though you'll have a specialist who may have spent 4-6 years after dental school studying surgery, oral surgery, periodontics, prosthodontics, whatever the case may be, but that doesn't necessarily mean that they have they've placed a lot of implants. So when I'm just showing you this is a cross-sectional view. Unfortunately, this implant is integrated, but it's hanging on by a thread of bone, very minimal bone that's supporting this one implant. I'm only showing one because there were multiple that were a little questionable, but I did what was called a reverse torque test. So I try to unscrew the implant. And if it doesn't unscrew, even though it's not, what I love about it is that, and the body is remarkable, is even though it's hanging on by a thread of bone, that bone is still pretty dang strong, you know? Mm-hmm. So, this implant is basically sitting in the sinus with no grafting in the sinus whatsoever. It's held on by a thread of bone here. This is really what's supporting this implant is all this bone right here. So, again, just goes to the doctor places these implants and then just says, okay, you're done, Mrs. Jones. That's not her name, but and good luck finding somebody to restore the case and spending a ton of money on the surgery. So with now taking a proper view of, implants placed, this is the pre-op or the after image of our patient here. So you can see we've got the implants. They're in the sinus. There's bones surrounding each implant around the sinus. But what I'd like to do is show a cross-sectional view of what that looks like. So, and we can compare it to that other picture, but you see we've got an implant. It's in the sinus. This is all grafted in the sinus. This implant is stable. The bone is surrounding it. Notice how clear this black area is. That sinus is very clear. There's no infection. There's no inflammation. But the implant is fully intruded into the sinus, but fully surrounded by bone, which is a big contrast to, I know these are x-rays, and for me it's so easy to see, but we'll move on from this. But long story short, there's an art form to implant surgery. And it's not the, what do they say? It's not the arrow. It's the archer, the guy shooting the arrow. Mm-hmm. So here's the after on that case. So here, so grateful that she did not do an all-on-4 and extract all those teeth and go through all that, because it would just be a travesty. It doesn't feel the same. I mean, it's really not a whole lot different than this, other than the fact that the palate is not covered. But
and she's got 11 implants, but only 3 of them are being used, right?
Right.
Is that what it is?
In that case, yeah. But once she got to me, I utilized each implant, and fortunately, they were all integrated. And there was some bone loss around some of the implants because of that denture, because of having had this in there, and then the tissues were pretty inflamed. But because because she kept it as clean as she possibly could, and you can see like the exposure of the implants, and so, but it was well enough that we could go ahead and give her a really nice aesthetic outcome. So for that, I think that it is a wonderful procedure and so much better than having some form of a denture, like this here. So
Yeah, no, that is an interesting case, and it's good. We get a lot of feedback from just people who are looking into our content and how transparent we are with the cases that we do and the content that we put out and the questions that we answer, right? So we know this is great, but also we have lately been starting to kind of get more into the mainstream media of dental implants.
Right.
And I know our producer wanted us to review a video that's on TikTok. And I know you have that video.
Yeah, let me pull it up here. I think I have it here somewhere. I got a lot of stuff open. Okay, so we just kind of been searching, the internet and came across, and hopefully you can hear the audio on this. I don't know about this case, literally just kind of fell upon it. Our production manager fell upon this video, so he shared it with me. So apparently, just as a backstory, I'm just reading into this. Patient spent $50,000 on an all-on-4 using what's called a zygomatic implant. So zygomatic implants go into the zygoma, which is the cheekbone, essentially. And it's because they use zygomatic implants generally because there's not enough bone, and also because they want to avoid the sinus. They don't want to intrude the sinus. So we'll play this video real quick, and it's loaded with, we could talk about this all day long. It's loaded with information, I think. So we'll play this video real quick. So hopefully you can hear the audio. And of course it's glitching. Our internet is... In a nutshell, what he's saying is, patient spent, the chewing gum cost this patient $50,000. When you hear that, what comes to mind? When you see this video, that the chewing gum cost the patient $50,000.
Well, if whoever plays that or did the work warned me about it, then it's my fault. But if they didn't tell me about it, then it's their fault. But at the same time, that's why I'm getting dental implants, right? So I can chew and do whatever I want.
Exactly.
And I'll be able to do what.
Let me just. It's not your fault. It's not the patient's fault. It's the surgeon's fault. If you're placing implants and again, it goes back to torque values. And when I talk about, and if we use wood as an example, if I am placing a screw in oak, and I have that screw is going to drive into that oak, and it's going to be hard to put a wood screw in oak, right? Versus, let's say, pine. If we use pine, and I first have to drill a pilot hole, and then I drill a screw into that pilot hole. The pine is softer, so I have to be more careful, and I've got to kind of make the hole for the screw that's going in a little smaller, so that the threads on the screw can bind into the pine because it's a softer wood. And so I have enough torque on that screw, right? Now, if I'm placing a screw in drywall, now I really, really have to under-prepare. I can't really depend on that drywall too much to support the screw, because it's eventually the load or the weight of the picture or whatever is going to be supported by the screw is going to bear so much pressure on it that it's going to pull through, especially if there's too much weight. So what happened here is that the doctor placed these implants. They had probably little to no torque. There's absolutely no way that you're going to lose all 4 implants and the prosthesis by chewing gum. Because if you're going to, which also by trying to load a case like this immediately, meaning putting the implants in the bone and making the bridge and putting the bridge on right away, same day, because that's what all on 4 corporate centers are doing. And they have to follow that protocol. They have to follow that model because that's what everyone is doing. And so you're going to compromise your 4 zygomatic implants and risk the patient's $50,000. It's not the patient's fault that the case failed. It's the doctor's fault that the case failed. If you do not have enough torque on these implants, you do not load the case. You let the implants heal. You let the bone integrate around the implant, and you tell the patient, you know, Mrs. Jones, I'm sorry, but you're going to have to be in a denture while these implants heal, because I just did not get enough torque. If she was diabetic or who knows what the case may be. Every single implant that I place, I have to treat differently. I have to treat it the way I prepare it, the whole, whether I'm placing in drywall, oak, pine, whatever type of bone that I'm placing in. I'm using wood as an example of bone density, but so, you know, it's my responsibility to ensure that I don't do something stupid like placing a bridge on implants that have very low torque values and then just crossing my fingers and hoping, because all-on-4 is great, right? It works on everyone, and loaded in a same-day teeth in 24 hours. I mean, you get whatever you want, like, but that's just not the way that it works. It's just simply not the case. And so to try to even post this video makes my head spin, because it's not the patient's fault. It is the doctor's fault. You do not load these sort of cases when you don't have enough torque. And so, I would caution patients who are in this process or going through the process, thinking about going through the process, that you understand that, you know, it's a delicate technique. How long does it take a person to lose all of their teeth? Or, you know, I mean, when I look at a case and I'm having to extract, because there are patients where I've got to remove all the teeth because of periodontal disease, because of decay, because they're broken down, the mouth is broken down, the mechanics of their mouth isn't working anymore. So there's a lot of factors that play into the loss of somebody's teeth. It takes years and years and years for that to happen, for that breakdown process to happen. And to market and sell and to claim that you're going to solve that problem in 24 hours is just, to me, just is crazy. Can it be done? Yes. Can it be done successfully? A lot of times, sure. Is that the primary goal, is to give teeth the same day on every single patient and run the risk and compromise potentially the implants that are placed, or the hard work that you've done for preparing for the surgery, for grafting different areas, for placing the implants? Like, you don't want to compromise that. It's not worth that compromise just to put the teeth on and on the same day, you know. And there are companies out there now that they promote the permanent set of teeth in 24 hours. So it's you know, I really just caution patients, you know, do your homework and watch, you know, just think about it. It just, if it doesn't make sense, then, you know, I would highly. Then it's just, you know, go with your gut, I guess.
Yeah. What I like about TikTok, I don't have TikTok, but TikTok and Instagram, what I like about it is videos like this, they go viral. The comments, you can get a lot from the comments. So I'm wondering what the people are saying there. How much of this profit such a... They're just kind of mad about it. I mean, I would be too.
Yeah, I mean, it is. Comments and people are wise, right? I mean, if you see something like this, you know that something doesn't add up. And so, but anyway, so just do your due diligence, do your homework. There's no magic bullet to solve these problems. Every patient is different, every case is different, and treat it as such. So
do you think this was from one of those all-on-4 centers, or just?
No, actually, it's a private practice. Private, yeah, it's an oral surgeon who, you know, I'm not sure where they're located, but.
To answer your question,
I don't know if people know this.
Implants.
I didn't even know this.
Dental
I'm
implants.
sure they don't know this, but
I
understand that
dental
oral surgeon, they don't necessarily are placing implants
A lot.
From what we know, the numbers that we know, because we work with Nobel Biocare closely, is that, what is it? An average oral surgeon places, what did they say? Is like,
yeah, it depends. I mean, practice is different. I would say on average they probably place 10 implants a month.
10 implants a month.
10 to, a high volume practice probably does 20 implants a month. A high volume oral surgery practice or, surgical practice, whether that be surgery, periodontics, I'd say 20 implants a month would be a pretty high volume,
Do you think is full mouth cases, or is it just like 1 or 2 implants here and there?
Usually it's 1 or 2 implants here and there, and that's one of the reasons, and I'm glad you asked that question, because full mouth case is very different than a single implant here or there, or a quadrant of implants. In fact, if we look at, I saw a video, I forget where it was, but anyways, of a young lady who just had a couple of teeth, and she was probably in her 20s or something. But so a single implant is very different. The way you treat it is very different than treating a full mouth, and the approach is very different. The implant surgery and the placement of the implant is also pretty different. It's you're dealing with generally a lot more bone. But it's, but again, you just have to treat each case individually. And so, but if they're not doing a lot of full arch or, full mouth cases, then, you can run into these sort of things. They're just kind of hoping that the all-on-4 is going to solve the problem.
Yeah. Well, that's what I was going to say, that in anything, in any practice that you do, like for example, I like to be involved in boxing quite a bit.
Yeah.
And if there's a fighter or a boxer or any sports that isn't active for a certain period of time, when they come back and they try to perform, that's even like the odds are against their favor. Like even in Vegas, they bet against it because they were inactive.
They've been out of practice
exactly
for a while.
Well, they've been practicing, but they just haven't
been fighting
or performing. Exactly.
Yeah.
And
which is so different than practicing, right?
100%. And that's what makes me think of this is, okay, they're placing an implant here, 2 there, but maybe they'll do a full mouth once a year, once every 2 years.
Even if it's once a month, that's not enough.
Doing a one full mouth?
Full mouth once a month is not enough because you just don't get that repetition. I mean,
okay.
But I doubt they're doing a full mouth or upper and lower arches. I don't know. I don't know. But you need a lot. You're right.
Yeah.
You need a lot of practice. And, like using the boxing analogy, even sparring in the gym and working out is completely different than, I assume, fighting in the ring.
Oh, for sure.
There's no comparison because it's game on, and that's I do surgery every 3 days a week at least, and I love it, but it's like getting in the ring. It literally is like getting in the ring. It's like I'm sparring, I'm battling. I got to go to battle. And my game has to be on point on every single aspect for that patient throughout the entire 7, 8, 9 hour surgery. I have zero room for error.
Yeah, I would say it's even I wouldn't even call it dangerous, but more like past sparring or even like an actual fight, because now it's it's the patient and you, right? You have to perform for the patient while they're asleep, right? And the match is like you're just looking out for yourself. So I feel like people need to consider that with whoever specialist they go to, how many cases, full mouth cases, if that's what they need, they're doing in a month or in a year, because like you said, it requires repetition in practice, like anything in life does, right?
Oh, for sure. And to get outcomes that work, and I would never blame my failure on a patient for chewing gum or chewing whatever. I can't, because that's the reason they're getting their teeth redone. That's the reason they're rebuilding their mouth. That's the reason they're getting implants. That's the reason they're making this investment, is so they can chew, they can eat, they can chew gum, they can speak, they can sing, they can play their trumpet, whatever. I need to make their mouth as close to what, the biomimetics, the way that the materials, the fake materials, the artificial materials that I use, because titanium, zirconia, porcelain, screws, all of grafting material, all of these materials are they're not natural, right? I mean, the patient was not born with implants, so I have to make those implants mimic nature. So the biomimetics and how it mimics nature is my job in creating something that will mimic what they lost as close as humanly possible.
Yeah.
And that's why when I go into a case and when I look at a case and I have a new patient, like this here, I would never recommend extracting all these teeth. I'm going to do everything I can to build the bone, build everything around so that I'm not going to take away from them something that is critically important, which is their natural teeth. And I'm just going to be adding to, it's unfortunate they lost the teeth that they've lost, because they've lost quite a lot of them, and the mouth is now out of balance. So it's my job to restore it back to normal, natural function. And so, and it is very similar to getting in the ring, I guess. I mean, I used to spar when I was young, taekwondo and stuff, and you'd have to really get in the zone, and that's what I have to do as well every time I go into a surgical case. And I've done it thousands and thousands of times now, so it's it's just part of my game. But like even just driving here, I have to kind of think about it's like getting here, and just like it's a process. And so that when I walk into that room and patients under general anesthesia, it's like, okay, it's game on.
Yeah, and that's another thing I wanted to bring up. Well, there's two things, but that going along with that, Dane and I kind of help out with everything else.
With a lot, not just everything else.
Because we understand that. I know athletes, like when it's time to perform or they're preparing to fight, or to box or anything like that, they try to make not as many decisions, because that takes away from like focus and energy. And so
in the fight, in the ring,
like you only have
even
so
down
much.
to like the clothes they put on. So.
Exactly. Yeah. That's what, like, I was just listening to a book. I forgot what it was, but like Mark Zuckerberg and like all these like successful people, right? That they don't even care about what clothes they put on, because they don't want to take their time and energy to make decisions for that, because they need all their time and energy for that. And that's how, there's times where like after surgery, you're like, we can tell that
I'm done.
That's it, But that's great. Like patients need to know that you are dedicating all your attention, energy, and focus
100%.
in your entire day for this surgery to be successful.
Yeah.
And that's something that, if a doctor doesn't know that, or they go somewhere where it's just like, let's get it done as fast as we can, they're not going to do it right, Yeah. So I think that's, something that I wanted to bring up, because I noticed that, and we know, like, it's after you're done with the surgery.
Yeah, I mean, I have my ADD OCD is off the charts, and my kids kind of and my wife makes fun of me because I do wear the same like color palette, I guess you would say, and the same clothes. I get home and it's just one thing I don't have a whole lot of swag, we'll say. I mean, a little bit, but not a lot. But it's true. I mean, it's just that it's one more thing that I just don't have the mental capacity to worry about. I mean, hopefully there'll come a time when I'll have better swag. But right now, I just put all my attention towards my patients. So, but it does require that. It does require having a very high level of focus, and there's never an excuse to blame a failure on a patient, because the patient's coming to the doctor for their expertise and for their judgment, whether it's in the beginning when you first meet the patient or when you finish the case. They're coming to you for your expertise and your judgment, and so if I have a complication, then I'm going to go in and correct and repair that complication because I'm human as well and don't have a lot of them, but I've had cases in the past where I've had to go in and revise things. And when that happens, you just keep that same level of focus. And I can't blame the patient for eating, hard bread or pizza or something if something fails. So I have to build it so that it does not fail. That's my job.
Yeah.
And so, all right. Let's see. So we kind of covered quite a few subjects today. There was one other, and I kind of lost my. We showed this TikTok a few weeks ago, and I don't know if you can hear the audio, but this lady has kind of gone viral, I guess, and she's the queen of mini implants. And you can see that she's got like 10 or 12 mini implants in the upper jaw, probably 5 or 6 or 7 on the lower. But ultimately, she has a denture. And I've showed this video before, but which is all fine and dandy. But she is wearing a denture. She's promoting dentures, but again, like I said last time, she doesn't know what she doesn't know. And if we were to put her in a fixed bridge or fixed zirconia prosthesis with a proper number of implants, proper implant placement, or actually if I was to do like I did with our good friend Matt Sturm and Sons Plumbing in Massillon, Ohio, and Matt drove all the way out here from Ohio to get his teeth fixed. If I were to do a case like his on her, it would be a complete life-changing thing for her. Or like, having a sufficient number of implants like this patient here and restoring it so it's nice and strong, firm. When the patient bites down, they get that, the bite that they need. They can chew anything, they can eat anything. It doesn't interfere with their speech. Aesthetically, it looks beautiful. There's just so many factors that have to be considered, and when you've got dentures, you just simply don't have the ability to chew and eat and masticate the food like you should be able to. So yeah, I mean, it is a very, it's a delicate procedure, and and as we grow and as Trust Implants grows and as we add partners and collaborations with different companies, our goal is to continue this narrative. And the narrative is that we are going to provide you the very best solution for the replacement of your lost or missing teeth for you, and not promise you teeth in 24 hours or teeth in a day or something that might potentially compromise the outcome of your case, because it's just not worth the loss, right? I mean, the loss of the implant, the loss of time, the loss of money, it just becomes very frustrating. So I would much rather kind of walk a little more slowly. We're going to get it done as quickly as we possibly can, but we're going to do it at a level that that will allow for and not have the excuse of you were chewing gum so the case failed. That'll never happen here, because we will always follow surgical protocols. When I have sufficient torque on the implants that I place, that comes from just repetition and having done this so many times, from the initial treatment plan and diagnosis. When I look at an X-ray and just knowing what to anticipate before I go into a surgery. So there's so many different variables that I have to consider, that I do consider on every single patient, so that I don't have a situation where we blame the failure on chewing gum or something like that.
And Doctor, the second thing I wanted to bring up with that is you have brought up, or you've mentioned before, that you're replacing an organ, right? You said that.
Technically, I mean, we're replacing,
Pretty much.
kind of like an appendage, I guess, an arm, a leg. I mean, it's not technically an organ, but it's like an appendage. It's like a hand or. Your teeth are critically important. It's the beginning of our digestive system.
Yeah.
So
it's not till like recently that we've been seeing that people, they're not even getting like a full-on leg, like someone who's missing a leg or missing an arm. You can see it's like a robot type of thing, right? Or with the leg it's kind of like a spring-looking thing. I don't know. I've seen those.
Yeah. Very kind of rudimentary. I know that the prosthetics, because that's what we're doing is prosthetics. Prosthetics for hands and legs have not changed a whole lot. I don't think. Would never claim to be an expert in this field, but the way it attaches hasn't really changed a whole lot. It's more of like a suction type thing. I've heard recently that they have hands that can tie into the nerve endings but in reality I don't know how well that would work, but you're right. We're trying to replace something that functions as close to nature as possible.
Yeah. And with what you had mentioned, right? Like eventually in the future, maybe we'll get to a point where you can get something that you can move but so far right now, out of all the procedures like that you need to replace.
Prosthetic replacement,
the dental implants is as close as because you don't even know it was replaced. Like our patients leave and everyone's like, they ask me why I have such a nice smile. They would never imagine that.
Yeah.
Like if you saw a person that got
that's a good point, man.
A leg replaced, right, and they put a prosthesis,
right.
You can tell right away. So like you've mentioned is you get as close as like 90% of full functionality and as far as like you being able to use it, but then also the looks of it, like it looks better than a normal smile if it's what they want to do, right?
Yeah.
So people have to consider that too. Like out of all those procedures,
when you've lost something so critical and vital as an arm, a leg, or your teeth or mouth, or your teeth, not your mouth, but it is your mouth because it's how you chew and eat. Once you've lost that, what's the value of it to have it restored to as close to nature as possible given the materials that we have? It's hugely valuable.
And understanding that since it's that close, it's almost like 90%, that it's going to take time and it's got to be done right.
Yeah, exactly. Right.
Because it's the closest you will get, and it'll last for the rest of your lifetime.
Yeah.
And we've seen that here. We've shown this. We have it on our social media, and we're planning on doing a video with her. But a case that you did, I think it was in your residency years at 1999, and still 2024 now.
Yep.
Case is fine.
Still intact.
Still intact.
And that's because I used those same principles that I learned as a resident that back in that time, and I've told this story before, but people thought that at Loma Linda and the implant prosthodontics residency, they thought we were crazy, that we were putting so much time and effort and energy into dental implants. But that was way before all the all-on-4 centers and the corporate money was thrown into implant dentistry. And so, but we wrote the books, we did a lot of the initial research. My colleagues there are still writing and doing the research, but we were doing cases that nobody else was doing. No one was doing what we were doing back then.
Well, even now, I would say.
Yeah, even now. But I take those same principles, and like I've mentioned in previous live streams, because I spent the time in like bona fide training and under the umbrella of Loma Linda University and of having mentors and professors and people, they build in you a level of stature, right? So a level of not stature, but excellence. Like they demand excellence from you. They demand that you be the very best that you possibly can be in all phases of the process: surgically, grafting, bone regeneration, sinus grafting, and the prosthodontics, so the fabrication of the teeth and the impressions and the materials and the even down to the impression, this die stone or whatever the case may be. Nowadays we use more digital, but I mean, we had to know every single aspect of every single step of the entire process, from the treatment plan, just the design of the case or the planning of the case, to the final delivery execution, and to the articulation, the bite, how the teeth touch. And we had to know A to Z. And so we didn't stop at like just the surgical phase, right? We had to know all the way to the completion. And that's why I say, you know, I'll never blame a failure of mine on chewing gum, so to speak.
That'll suck.
Yeah. So, but anyways, well, we are out of time for today, and we appreciate all of our viewers, and you know, hit that subscribe and that like button, and we've got a lot more content. Stay tuned. Watch us every Thursday. We try to start around 9:30. We're a little slow around here, but I think today we're a little bit better. Yeah, thank you to all of our viewers, and we'll see you all next week. I'm Dr. Willardsen here with Memo Gea, Trust Implants, trustimplants.com, and we'll see you next week.